Hi, guys. We are back with reducing risks as part of our diabetes eating and wellness diabetes education series. We're here with Julie Nance. Of course, she is not just a professional diabetes expert, but she's also a patient. So really excited to talk with her about this session here. So thank you, Julie. Take it away.
Okay, thank you very much. Let's talk a little bit about reducing risks. There are some risks that come along with this disease. It is a lifelong disease. It is going to progress. So we know that that's going to happen with this disease, but how you take care of yourself, exercising and eating healthy and testing blood sugars and making sure you take your medication and visiting your doctor often, all of these things can help you to reduce those risks of some of the complications that come along with this disease. So we want to go through some of those things today so that we can talk about ways so we can also prevent those as much as possible. So as of 2014, based on this slide, there was almost a little bit more, 22, 23 million people with type 2 diabetes. That's a very large number of people. And through all of those, we know that there are many of those who may have complications. And we often see a lot of times these complications go hand in hand. And we'll talk a little bit more about that as we get into each one. So some of the risk factors for complications of uncontrolled diabetes. Now, I do say uncontrolled diabetes. Somebody who is very well controlled may not have any complications, but just having diabetes puts them at risk for the complication. So I have had diabetes for almost 30 years now and not a single complication at all. Nothing that's related to diabetes at all. I've known patients who are 79 years old, never had a complication, but that is because they were so well controlled for most of their life. So it is absolutely possible to live a very high quality life and stay well controlled with your blood sugar levels. Smoking is one of those things that's going to cause and lead to complications. Smoking by itself, whether you have diabetes or not, is going to lead to a lot of health issues. So the best thing to do is to stop smoking if you currently do. Please speak with your physician about how you can stop smoking if there's something that they can do for you to help. Overweight or obesity does increase the risk for certain types of complications, specifically heart disease is one of the ones that comes along with that more often than not. Physical inactivity, again, heart disease, yeah, but also physical activity can increase the risk for certain types of cancers, which is not related to diabetes necessarily. However, it can feel like a physical activity can cause a lot of problems, and actually lack of physical activity is a risk factor for diabetes, for type 2 diabetes. High blood pressure, high cholesterol, and high blood glucose. This is probably one of the big ones. High blood sugar levels, high, riding really, really high for a long period of time, years and years and years and years, is going to increase your risk for any complications much faster than just about any of the other ones will. Cardiovascular health, people who have diabetes are at a greater risk for heart disease than the average population. So that means that just having diabetes, whether you are in control or not, you are at greater risk for heart disease. So if there's a family history, now you're at even greater risk. If you're overweight or obese, now you're at even greater risk. If you aren't physically active, now you're at even greater risk. So those risk factors start piling up on each other, putting you at even greater risk for it. So the lower your A1C is, the closer to a controlled number for your A1C at 6.5 or 7%, then the lower your risk of a heart attack or a stroke. Now, people can have heart disease but never have a heart attack or stroke because they keep well control of it. And that's kind of a goal. So it's keeping your blood pressure under control, 140 over 80, preferably 140 over 80, not closer to 90, but in between 80 to 90 is at risk for. That is an elevated blood pressure. Anything that's higher than that is going to be at high blood pressure or hypertension. Heart disease is the leading cause of death in the United States. So that is, and it is increasing. And typically those people, the number of people that we see with heart disease who also have diabetes, that number is very, very high. And a lot of times somebody who may have a heart attack and be hospitalized for the heart attack, if they did not have diabetes prior to that heart attack, they will be diagnosed with diabetes shortly after. That's something that we see often. White coat syndrome, not necessarily a diagnosis, but it's not, but it's one of those things that when you go to the doctor's office, the minute you see the white coat, blood pressure starts to rise. It is a fear factor, it's anxiety, all of that increases the blood pressure. So it's the minute you see that white coat, I know lots of people who have the white coat syndrome have to sit there for a moment, relax for a moment, test blood pressure again, lo and behold, it's back to normal. So this is something that we do know that people can have, and we are very aware of it. However, we do recommend they test it at home, and if they see that they are high at home more often, even when they are more relaxed, and also high at the doctor's office, then there may be a trend we have to kind of keep an eye on. All right, so peripheral artery disease is a narrowing of the blood vessels, and this can certainly increase the risk for a lack of blood flow down into the feet and the ankles. And usually we see this in older age, but this blood flow can really affect, especially healing, it can affect of the feet if the feet are injured. That blood with that oxygen and the nutrients need to get down to the feet for healing, but a lot of times it can't get down there. The feet are cold or they even may go numb, and that can lead to some of the nerve damage. All right, heart healthy diets. There are lots of heart healthy diets. We do have several listed here. The DASH diet, that's probably one of the most popular ones, and that's a really healthy diet. It stands for Dietary Approaches to Stop Hypertension. Very healthy diet. Now, I will say this, the dietary or the DASH diet is not always low in sodium. In other words, we don't take away sodium completely, because even natural foods contain sodium. Two stalks of celery contain 70 milligrams, but I'd much rather you get your sodium from that than from a can of beans. So it is lower in sodium, but it's because it is more natural foods rather than a lot of processed foods. So fruits and vegetables and low-fat dairy, and we do say low-fat dairy. That fat, the saturated fat that is in the higher of the whole dairy, like whole milk, for example, can increase the risk for a rise in your LDL cholesterol or your bad cholesterol, which can then increase your risk for heart disease. Smaller portions, you notice that lean poultry and meat, so those leaner cuts of meat and the leaner poultry, which is going to be your white meat, is actually leaner than your dark meat. I know dark meat tastes better. I get it. It has more fat. It's juicier. I understand. But that white meat is actually a little healthier. And of course, cooking it without the skin on is going to keep from increasing the saturated fat content. Fish is always one of the better sources, especially if it's that fatty fish like salmon or mackerel or herring, which is high in omega-3 fatty acids. Now, small amounts of oils and nuts are always really healthy, plus limited alcohol. Yes, I said it, limit the alcohol intake, and you know who I'm talking to. All right, so the MIND diet. The MIND diet is a mix of the Mediterranean diet and the DASH diet. And some of the studies behind the MIND diet is that they're seeing that there is a decrease in cognitive dysfunction. In other words, dementia is for those patients that have followed it, that are part of the studies, that have followed this diet for a period of time, they found that the incidences of dementia were decreased in these patients. It's very exciting, very exciting. All right, so the Mediterranean diet, it is more of a whole foods diet. It's primarily plant-based. Yes, there is pasta, but this diet tends to be a little low carbohydrate. It's not low carbohydrate Let me say this, there is no definition for low carbohydrate. We don't know exactly how much carbohydrate means low carbohydrate. But this is a little lower in carbohydrate usually than what we normally would consume. So yes, you do have pasta, but it is a whole grain pasta, which means it's going to be higher in fiber. It's not going to affect the blood sugar that much, but it's also higher in fruits and vegetables and beans and wonderful whole foods that are more plant-based foods. Animal sources are allowed on the Mediterranean diet, but not every day. It's something that can have maybe once a week, and it's a very small serving size. Plant-based is what we used to know as vegetarian diets, but vegetarian diets is now a blanket term for numerous types of vegetarian diets. Funny story, a friend says that she's a vegetarian, but she will eat chicken and beef and fish sometimes, but then you're not a vegetarian.
Flexitarian?
Flexitarian, yes, that's what I am. I'm a flexitarian. I'm not opposed to eating animal sources. I am plant-based most of the time, but I'm not opposed to eating animal sources, and I will certainly eat them. But plant-based means that it is based in plants, that the foundation of that is plants with fruits and vegetables and whole grains and legumes. So that's your best place for it, and that people who follow a diet that is plant-based, we do find that those individuals have a less incidence of obesity, less incidence of type 2 diabetes, less incidence of heart disease, and of cancers. All right, kidney protection. So the kidneys are really important. They're your filters for your body. They're so important in your body. And we want to protect our kidneys as much as possible. Yeah, we can go on dialysis, and you don't want to have to go on dialysis. You want to prevent that as much as possible. So there's what we call the urine albumin to creatinine ratio, or the microalbumin is another word. And you may have seen a microalbumin. This is a pee in a cup test. You pee in a cup and they measure the microalbumin. This looks at the protein that is being spilled into the urine. And if there is a large amount, usually anywhere between 0 and 30, that's normal. Anything greater than 30 means that there may be some problems with the kidneys. If there are problems with the kidneys, they're going to test your GFR, or your glomerular filtration rate. This number also gives us an idea of what stage of kidney disease that you may be in if you are in one of the upper stages. I will say this though, everybody over the age of 18 is already in stage 1 of chronic kidney disease. Kind of scary to think, but most people will never leave stage 1, or when they're 80 or 90, they might move into stage 2, and that's just part of the progression of life. Is us getting older. But those people who have diabetes, they're at higher risk for moving along those stages. There are 5 stages of chronic kidney disease, and they're at higher risk for moving along those stages a little bit faster. So we want to slow that progression down as much as possible by keeping blood sugars under control. There are 2 things that can actually damage the kidneys more than anything else. One is blood sugars, high blood sugars, and the other is high blood pressure. So keeping both of those under control are really, really important. Get the test done at the diagnosis, and then every 5 years is what the recommendation is, and it really depends on where you are at that initial diagnosis as to how often you have those tests done. If you are perfectly fine at that first test, then you may wait every 5 years, but if they find that you are in maybe stage 3 or starting out at stage 3, then they may test it a little bit more often. But you will, anytime they do a blood test where you see your blood sugars and maybe your calcium and your sodium levels, and that's called a metabolic panel, your GFR is always a part of that. All right, cholesterol. We all have heard of LDL cholesterol and HDL cholesterol, right? HDL cholesterol. Caroline, what is HDL cholesterol?
Okay, so HDL cholesterol is known as your good cholesterol. We want this to be a bigger number. One of the best ways that you can increase your good cholesterol, maybe your H is for happy here, HDL cholesterol, is with exercise. We want to see the more that you exercise, we want to see it pay off with this HDL. increase. So as your HDL increases, your LDL might actually decrease. And that's the name of the game, guys.
Yes, it is. Right on the nose. Exactly. HDL, I used to say HDL is healthy, so, and it's also high. So we want this number higher. LDL is lousy, so we want this number lower. L for lousy, L for low. And LDL is your bad cholesterol, AKA your bad cholesterol. So this is the one that increases your risk for heart disease. This is the one that increases that collection of plaque in the arteries, which increases the risk for heart disease and stroke, because that plaque can also be increased in the vessels that go to your brain. So it does increase your risk for a stroke as well. We want to keep these numbers where they need to be. The recommended for LDL for somebody who has diabetes is less than 70. The recommended for HDL is for men over 40 and women over 50. Lipid means fat, just means fat. So everything that falls into your lipid, your LDL, your HDL, these are all lipids. Cholesterol is a type of lipid. Triglyceride, the word triglyceride actually means fat. So there are triglycerides in your body makes triglycerides, but you also eat foods that contain triglycerides. So when a food contains fat, it contains triglycerides. So triglycerides, that 150 is too high. Anything that's greater than 150 is too high. I've seen patients with a 4,000 triglyceride, extraordinarily high. And a lot of times when we see somebody with that high, we know that that is a hereditary factor, but it can still rise that high if somebody is eating a lot of sweets, a high calorie diet, or drinking a lot of alcohol. We will certainly see those number pretty high. Your total cholesterol, it should be less than 200. Less than 200 is the goal for your total cholesterol. Now, if your LDL is high, you can almost guarantee that your total cholesterol is going to be high as well, because your total cholesterol is about 60% of that comes from your LDL cholesterol. All right, so healthy eating for cholesterol, limiting that saturated fat intake, switching out that saturated fat and replacing it with poly and monounsaturated fats. So in other words, those monounsaturated fats like olive oil or canola oil or nuts or avocados, or I could go on, really healthy foods, and then decreasing that saturated fat, which is you're gonna find it like in the skin of your chicken, or in red meat. You're still gonna find some saturated fat in the breast of the chicken, just not as much when you cook it with the skin off. You're gonna find it in pork, you're gonna find it in meat. You are gonna find a little bit of saturated fat in nuts. So yes, it's in plant sources too. It's just not in very high amounts in your plant sources. So avoid trans fats. Trans fats actually were banned in 2016 by the FDA. But the FDA gave the food manufacturers some additional time to get rid of them, because the food manufacturers had so many, they're stored in so many foods with trans fats in them in their storage, they have to get them out to the public. So they gave them until the end of 2018 and 2019 to finally clear out everything. So at this point, everything that's being pushed out by any foods that are being sent out by food manufacturers cannot contain trans fats. So you will still find foods though with trans fats in them. Trans fats are anything that says partially hydrogenated. Partially hydrogenated soybean oil, partially hydrogenated coconut oil, partially hydrogenated palm kernel oil. You will find these in still find these in some foods that are may still be on a shelf somewhere. So be careful. Some of those pastries, yeah, donuts, yeah, probably won't find them now with them, but if you find some that have been sitting on a shelf, and trans fats are the reason they can sit on the shelf for such a long period of time. But you may still find some older ones that may still have some trans fats in them. So we want to limit those. Trans fats are actually more harmful to the body than LDL cholesterol is. All right, fish 1 to 2 times a week, and that's preferably that fatty fish like salmon or mackerel or tuna. This is the higher in omega-3 fatty acids, or omega-3s as we know them. And these are those heart healthy fats. And then eat fiber. You want around anywhere from around 21 to 40. 35 is about the best number. Getting higher than 40 is going to, don't go higher than 40. Please limit that. That's maxing it out at 40. And please drink a lot of water if you plan on increasing your fiber intake. Please. Fiber can actually help to control blood sugar levels. A lot of people eat fiber to help with their bowel movement, keeping their bowels moving regularly, right? All right, so the more fiber we add to that, then that's actually going to increase constipation unless you are drinking lots of water. So please make sure you're increasing your water intake if you increase your fiber intake. Very good, Caroline. All right, limit cholesterol. For most people, there are no longer any recommendations for cholesterol. But for people with diabetes, because of the increased risk for heart disease, we still have some limits. So we have to keep our limit to no more than 300 milligrams per day. Keep in mind that some foods are really high in cholesterol. The only foods that contain cholesterol are animal sources. You will not find any plant sources that contain cholesterol. All right, eye health. Eyes are really important. The number one cause of blindness is uncontrolled diabetes. So diabetic retinopathy is what it's called, and there's a retina in the very back of your eye. And if you've ever had your eyes dilated, then your eye doctor looks back to the back of the eye to see what that retina looks like. It's in the very, very back of your eye. What we'll find is sometimes there's some damage to that. There is blood vessels that are leaking, and we'll see that they'll see that those tiny little vessels will bulge and that they'll leak. And when they see that leaking, then we know that there is we'll know that there is diabetic retinopathy. People who have diabetes are also at higher risk for macular degeneration, for cataracts, and for glaucoma. In fact, I've been told that I have a cataract already starting, and I'm only 53. I know I'm young, and I already have one starting. So I know that that is a cause not because of lack of control, but because the number of years that I have had diabetes. The longer you have diabetes, the higher at risk that you, even if you're well controlled, the higher risk you are of some complications. All right, nerve health, nerve damage, or neuropathy is what it can happen to when blood sugar levels are really high for long periods of time. It actually damages those nerve endings. So if you can feel your toes, or if there's ever been any tingling, some people have explained it like walking on tacks at the bottom of their feet, and they feel that that's the nerve damage that is starting, as when they can feel some of the nerves tingling at the very end, and it can be very, very painful. So most people, though, may not feel any symptoms at all, at least not until there's numbness. But numbness is something that does happen, and it can occur in the fingers, but most often we find it in the feet. Controlling blood sugar levels is the best way to prevent nerve damage. Once it starts, there's no turning back. It can't be corrected, but you can slow down the progression of it by getting control of your blood sugars and keeping those under control as much as possible. Smoking is one of the biggest things that actually can increase neuropathy. So stopping smoking can certainly slow that down as well. Alcohol intake too. One of the things I always say with this one is, if you go outside and you do have neuropathy, please don't go outside barefoot. Please put shoes on before you go outside. You can actually step on something, and if you can't feel the bottom of your feet, you don't know that you've stepped on it, and potentially hurt the bottom of your foot. If you don't look at the bottom of your foot, of your feet, both of them, every single day, then you don't know that you have something wrong that can lead to an infection. So what you see here is an ulcer that is created from a wound that occurred and was never cared for, and because of high blood sugars that keep that blood from getting down to the feet for healing. So healing is very slow with those high blood sugar levels. Have your feet examined every single year. I say every time you go to your doctor, don't even wait for them to ask. Just take off your shoes and your socks. Don't even wait for them to ask. Just insist on them to look at your feet to make sure they're looking pretty good. There's other nerve damage that can occur, called autonomic neuropathy, and these can occur in your body. There's cardiovascular autonomic neuropathy, but there's also neuropathy in your stomach as well. A lot of different types of neuropathy that occur that's not just in the peripheral. This is called your peripheral neuropathy when it affects your fingers and your feet, but everywhere else in your body it's called autonomic neuropathy, and it can certainly affect other parts of your body as well. Sexual dysfunction, so libido disappears, erectile dysfunction, these are all part of autonomic neuropathy. Your stomach is gastroparesis. There's also your bladder and your intestines. So that means that the nerves can't push the food through for your intestines or for your stomach. The nerves can't push it through like it's supposed to be able to do. There are lots of other conditions that can occur. Postural hypertension, if you've ever gotten up really quickly and got dizzy. That's that orthostatic. That is it's your blood pressure dropping rapidly. Sleep apnea. This is something that is common, especially for somebody who may be overweight or obese. With weight loss, this can improve. Dental health, I do want to talk about that. Dental health is something that's so important because this is a big indicator of what everything else is. So if these are unhealthy, then everything else in the body can be unhealthy too. So we have to really take care of our teeth as much as possible. When blood sugars are high, that means our mouth is very dry. Without that saliva, some bacteria is not being washed away. Bacteria, saliva is actually really, really important. So those high blood sugars can increase the risk for dental caries, but also for tooth loss. So foods and labs, fiber, yes. Soluble fiber, there's two different types of fiber. There's insoluble and soluble. And the soluble fiber is the one that helps to bring down cholesterol levels. The insoluble is the one that keeps you regular. So the soluble fiber, you're going to find more in your wheat type foods, but with your soluble fiber, you're going to find it in your vegetables, and you're going to find it in oats and a lot of your legumes too. So your beans, your dried beans. Hydration. One of the most important things that you can do is to really, really make sure that you are well hydrated most of the time. A lot of people I know, I've heard from so many patients, I can't stand water. It's so bland. I love water so much, but squeezing a little lemon in it, or adding some type of Crystal Light, for example, has some things that you can just add a drop to it. Not enough to add a lot of artificial sweetener to it, but just a drop to make it really, really delicious and have a different flavor besides bland water. 8 8-ounce glasses a day. This is your typical. This is not necessarily the absolute recommendation, but as long as you're getting 8-ounce glasses a day, 8-ounce glasses a day, then you're doing pretty good. But you are going to get some other fluid. If you eat fruits and vegetables, you're going to get some fluid from those as well. All right, saturated fat, this increases the risk for atherosclerosis, and that is the hardening or the clogging of your arteries. We want to decrease that risk factor as much as possible by decreasing saturated fat. Do you need to absolutely get rid of all saturated fat? No, but you certainly need to decrease how much saturated fat that you do consume. All right, you can't pour from an empty cup. Take care of yourself first. So if you can't take care of yourself, you can't take care of those around you. That's pretty much what that says. So take care of yourself so that you can take care of those around you, especially if that's something that you really feel you need to do. Because without you, they may not be able to move forward, and we want them to move forward so you can move forward as well. All right, thanks so much.
It's a great message. Thank you so much, Julie. All right, guys, we'll see you next time.